CPR on a child, first check for danger. Are you the casualty in any immediate danger? If yes, then remove the danger. But if that's not possible, move the casualty. Now try to get a response by kneeling next to the child and squeezing their shoulders.
Can you hear me? Open your eyes.
Hold their hand and ask them to squeeze if they can hear you.
Squeeze my hand if you can hear me.
If there's no response, send for help. Call for an ambulance on 000, or if another person's available, ask them to do it.
Can you call an ambulance?
Open the airway by checking the child's mouth and removing any solid, visible material with a finger sweep. Once the mouth is clear, use head tilt and chin lift to open the airway. Look, listen and feel for any breathing. If they're breathing, roll them onto their side into the recovery position. But if you can't detect normal breathing, or if there is an absence of breathing, then start CPR. 30 compressions of the chest, followed by 2 breaths. Here's how. Begin by kneeling next to the child's torso. Place the heel of one hand on their lower sternum and push the chest down by 1/3. You may wish to use a 1 or 2 hand technique to perform CPR on a child. Now, do 30 compressions in time with the flashing indicator on your screen. Count out each compression until you reach 30. We'll wait while you do that. Reached 30? Time for the 2 breaths. Gently tilt the head back, lift the chin, seal the nose, and place your mouth over the child's mouth and blow to inflate their lungs. After each breath, look for the rise and fall of the chest. That's all the breath you need, enough to lift the chest. Continue CPR at 30 compressions to 2 breaths until the person responds, or normal breathing returns, or the paramedics are ready to take over. This may be hard work, so if there are other people nearby,
Can you give me a hand?
get them ready to take over. As you continue to provide 2 breaths, make sure you have a head tilt and chin lift and that the chest rises and falls each time. If the chest doesn't rise, it may mean that the head is not tilted back enough or that the airway is obstructed. Care should be taken not to overinflate the chest. If the child is still unresponsive and not breathing normally, apply a defibrillator if one is available. Ensure the child key is inserted.
Infant child mode.
Follow the prompts of the defibrillator and be prepared to continue CPR if required and as directed. Otherwise, keep doing CPR until help arrives. When the ambulance arrives, the paramedics need to get to the casualty as quickly as possible, so have someone ready to meet the ambulance.